Hi everyone, and welcome back to the Hair Loss Show. In this episode, we're going to go to part 4 of our Q&A session, so stick around and we'll go through a few more questions.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Well, welcome back, and thanks again for submitting all your questions to the community post. Again, we were overwhelmed with questions. Unfortunately, can't get through all of them, but we're going to go through a few more in today's episode. So, Thanuja writes, let's say you apply Minoxidil before going to sleep. And if you're going to apply it again the next morning, is it a must that we wash our head before doing so, or can we just apply it even though the Minoxidil layer from the previous night is still there? Thanuja, thank you for your question. There's two things I want to say about this. First of all, you're probably overdoing it if you're applying Minoxidil the night before and again in the morning, because it sounds like you're doing it twice a day. And if you look at the half-life of Minoxidil, that's probably a little bit excessive. You probably only need to use it once a day. So first thing I would say is you probably don't need to do it as frequently. Once a day is sufficient. The second thing is if you're adamant that you want to use it twice a day, that's fine. Certainly you do not need to wash your hair between application. If it does coat the hair, that's fine. It doesn't matter because you're not trying to apply it to the hair anyway. Remember, Minoxidil has to penetrate through the skin. Anything that you apply to the hair is pretty much wasted product, because it's not going to do anything. It needs to be applied to the level of the skin, and certainly as long as you leave it on for a reasonable amount of time, that will absorb. There's no layer or barrier that will prevent any further absorption of any more Minoxidil if you were to apply it, say, 12 hours later. So that's perfectly fine. And so I hope that answers that question, Thanuja. So the second question today is from Oma. Some people say I should only use finasteride without stimulation to see if it's working, and more importantly, how good it's working. But my hair situation gets worse day by day, so I consider to use both stimulation and finasteride to get the best results. What do you think about this? And look, that's, it's a difficult question to advise you based on, the information that you've given me. And again, I come back to this point that you should make sure you seek medical advice, make sure you get assessed properly and be advised appropriately with regards to your medication. What I will say about it is that, you want to be on the least amount of medication possible because you're going to be on this long term. So sometimes it's beneficial to start on singular therapy and see how effective it is before adding a second agent into the mix, because if you add two agents in, then you're unsure over time which one has been more beneficial. Is it a 50-50 split? Is, one agent doing more of the heavy lifting than the other? But the other thing I will say about this is that if you look at the cyclical nature of the hair, the life cycle of the hair, any therapy that you start, you need to give it at least 6 months to see how effective it is. Before 6 months, it's unreasonable to go, right, well, this is doing its job or not doing its job. So you need to give it a good go. But again, I come back to the concept of making sure that you get a proper assessment. Please don't self-medicate, or certainly, based on, what you're seeing in this video, just go, right, okay, this is what I'm going to do. Make sure you get assessed properly and thoroughly and get good advice, right? But thanks again for the question. Right, next question from Arvind. Is it necessary to see blood or redness after microneedling to know if you are doing it correctly? I've been doing microneedling at 1.5 depth, but now no redness on the scalp. It is very painful though. Should I increase the depth? No, I'm sorry, I'm not laughing. I just want to be clear on this. If you are seeing blood, you're going too deep, all right? And you're actually probably causing more damage. If you're seeing blood, the needles are too deep, you're probably going to cause scar scarring, which is going to cause you problems further down the track. So you want to stimulate that area, so you want the depth to be at a particular depth for you as an individual, that it causes that stimulation. But if it's causing pain, if it's causing bleeding, then you're going too deep, you're doing it too frequently, you need to step back and give the area a chance to settle, and certainly reduce the size of the needle that you're using. All right, so bleeding and pain, you're doing it too far. All right, so hope that helps. Thanks again. We've come to the end of today's episode. We've got more questions that have been submitted that we're going to go through. Thanks again for watching, and we'll see you on the next episode. Take care.